Hi everyone, we're Team Bearcat and this is our COVID Idea Challenge. Here are our table of contents.
So the target population that we're going to be doing is the Hispanic population. And as you can see here, some other characteristics of them, like communities of color, immigration populations, and ESL communities. As you can see, there's a sizable share of young Hispanic adults that trust their doctor, healthcare provider. And most Hispanics are likely to get vaccinated, which is about 71%. However, there's still a sizable portion that are still hesitant, which is about 24%. And there's more cases, hospitalizations, and deaths in the Hispanic community compared to their white counterparts.
Another issue with being vaccinated is distrust and misinformation for these residents, and a majority of these urban residents are likely to follow recommendations from their Kentucky governor, the district health department, their personal doctor, and their pharmacist. However, currently, less emphasis should be placed on the community leaders, politicians, friend circles, and faith community that they interact with on a daily basis. These primary trusted sources of health information should be the personal physicians to provide information about COVID-19 and vaccinations against them.
One of the biggest problems is, again, vaccine hesitancy and accessibility. Consistently, smaller shares of the vaccine are going to Hispanic populations across the United States, and specifically here in Ohio, 21% of our Hispanic population is vaccinated, which is about 15% lower than their white counterparts. Some of the most significant barriers to vaccine hesitancy or to getting a vaccine include healthcare disparities across the Latino community, higher rates of poverty and more likely to live in crowded areas, less access to health insurance and healthcare, higher rates of chronic health conditions such as obesity, as well as language accessibility, insurance requirements, and immigration status. Overall, historically, there is a higher vaccine hesitancy in Hispanic communities compared to white Americans.
Although many public health officials in states have recognized the various barriers to receiving the vaccine for low-income and underserved populations and have produced a variety of initiatives in order to diminish these barriers, not all of the solutions do a good job at addressing the target population. The first initiative was from Cleveland, Ohio, where health officials have been hosting virtual town halls for people to drop by and ask any questions they might have about the vaccine. However, virtual initiatives are major barriers to the Hispanic population and often result in low participation. Additionally, initiatives such as free transportation still have shortcomings on the target population, such as language accessibility and the fact that a majority of the rides are only during working hours. In an effort to promote vaccination, many state websites have also highlighted common misconceptions, such as that the vaccine is provided at no cost, and however, this information is not always listed prominently, and it's typically not enough for people to lose their distrust of the vaccine.
To solve this problem of vaccine hesitancy in the Hispanic community, we propose implementing a mobile vaccination site staffed by trusted local providers, which targets community service sites. For this program, we hope to recruit trusted providers and staff from local community health centers and clinics. The reason being that 66% of Hispanic adults say that their providers do a very good job or an excellent job giving clear information and encouraging them to share concerns. Our what is a mobile vaccination site, and the reason we chose this was to eliminate transportation barriers and increase accessibility. We hope to specifically target sites with other community services, such as shelters, food banks, and churches, where people already are at, so that because these community sites have higher densities of populations, allowing for higher rates of vaccination. And specifically, we hope to have our mobile vaccination site run on non-traditional weekday hours and weekends, again, making it more accessible for low-income or working individuals due to no potential for income loss.
Here are our references. And that concludes our presentation. Thank you all so much for tuning in. If you have any questions, please feel free to email us at this email.